in the very end, we're still treating a human being, not just a tooth.
You founded the Artios Dental Group.
Yes.
What has been one of your most decisive moments in your career?
He showed me this traditional carousel slide and said, pick which one is the implant, and I could not. And that was the defining moment that I realized, my God, implants are going to change the way we practice dentistry. And I still saw a lot of patients with periodontal disease that are not treated properly, are not given the options of having implants. That's really unfair to them. And that's when we have to move on. And that was one of the most defining moments in my career, where it changed my life.
Welcome to Straumann ProTalk, the pulse of dentistry. My name is George Reber, and today I'm very pleased to be co-hosted by Dr. Christian Cherry. Chris, welcome to this episode of ProTalk. I'm super happy to have you with us. And Chris, actually, for good reasons, is jumping in for Andreas Utz, because stick around, he has to make an announcement at the end of this episode. So there will be even more content coming your way in the form of ProTalks. Now, Chris and I, we're both very pleased and honored to welcome Dr. Jeanette Chua here with us today. So welcome, Jeanette.
Thank you. Thank you, George. Thank you, Dr. George. And thank you, Christian.
So, Jeanette, it's a great pleasure to have you with us. You actually are traveling Europe right now, and you will soon be heading off to Paris, but we didn't want to miss the opportunity to actually have a conversation with you today.
Thank you.
So, when I looked at your CV, I was very impressed with what you already achieved in the past time. And in the beginning, you oscillated a bit back and forth between Australia, Melbourne, and also Singapore. Yes. So you got your first dental degree, then you practiced in Singapore. But then you also went back to Australia to get a commercial education, I understood.
Yeah, Masters in Applied Commerce.
Yeah, that probably comes in handy later on in your career. Then you actually went to Loma Linda University, so School of Dentistry, where you got your specialty education in implantology and also advanced periodontology. Amongst many other, I would say, education elements, you are a board-certified periodontist. And when you got back then to Asia, you started founding your own clinic. And in 2015, if I'm not mistaken, you founded the Artios Dental Group.
Yes.
And now this is comprising more than 8 clinics in Kuala Lumpur and around. And you also have co-branded clinics in Singapore, in Thailand, and recently also in Paris in France. Okay. So very, I would say, an interesting journey that you undertook. We also would like to talk in this episode, besides that, a bit about education, because you're a very passionate educator. And also here you founded your own institute. It has a very nice Italian name. It's the Ancora Imparo Education Center, which stands for I'm Still Learning. And it is a testimony of a continuous learning journey that you take as very important, I think, in your life.
Yes.
Now, besides all of these elements that probably people can read in CVs, for those who don't know you personally, Jeanette, who are you in just 1 minute?
I think in just 1 minute, I'm still a mom of 3 kids, which are my absolute joy. They are Maximilian, who is 15, Muriel, who is 12, and McAllister, who is 9. Well, a lot of people think that I just work and don't have a family life, but we do. And we all move on and we get on with life, and kids and family, it's a main part of what supports me to do so much in our career. Other than that, I think Artios Dental Group has grown from 2015 to now with Ancora Imparo and also a digital lab with our main partners, Mr. Idris Rasta, as well as Mr. Herman Lai, to be serving the community of dentistry to do digital workflows as well as aesthetic dentistry. I think that's the main thing. And every day, I still do surgeries. I still see patients as a periodontist. And that's the part that I enjoy the most. Yeah.
That's amazing. And you started your professional journey as a periodontist and also implantology. Now I'm curious, because periodontics, for example, we can have 2 ways. One, you're really focusing on treating disease. The other, really improving your soft tissue management so you can improve your implant skills. What is Jeanette Chua, periodontist, and what drew you to that in first place?
Well, what drew me into periodontics were because of my early experience. And I think you were talking about me being in Singapore as well as in Australia. When I was back in Singapore, I was very fortunate to be mentored by one of my first mentor, or my ex-boss, who was very much into implant dentistry at that point. So he exposed me immediately into implants. And that was the world 20 years ago where, it was so different. And when we see these patients that have implants, most of them are older, but you see the younger ones that need implants and you're wondering why. And when you see them, a lot of them have periodontal disease, and it's a disease that's so hard to control. And that came to the question of, why do we need implants? Why can't we control the disease? What's periodontal disease? And that's how the curiosity started, because of this difficult patients that we have to deal with over time.
I fully agree. So implants should be the last resort, and it's so much probably more impactful if you're trying to not need implants. And it might sound, let's say, strange if an implant company says that, but I'm very convinced that it actually should go in that direction. So
yeah. Well, I think it's about ethical care, and we are treating a disease. And if we're using an implant to treat a disease, we need to understand the environment. We need to understand everything that goes along with it. And in the very end, we're still treating a human being, not just a tooth. So, and it's a whole mouth that we're looking at. Yeah.
But again, honestly, the periodontology can go two ways, right? And despite all this purpose in treating a human and disease, there's this beautiful element of soft tissue management. And you take very good pride and care into going to that side of the periodontology. What do you find most rewarding in this segment?
So in periodontology, what intrigued me the most was regeneration. Because in order to regenerate, and probably because of my mentors and the people that I was with in Perio and Loma Linda, with Jon Egerberg and Professor Max Krieger, we were very much into proper regeneration, tissues, the hemidesmal zones, all the cells of what regenerates on the tooth, whether we can grow soft tissue, whether we can grow bone. And from there, it is important to realize that without regeneration and without handling the bone and the tissues properly, you can't recreate or reverse nature or reverse the disease. Thus, if you know how to handle regeneration, that's when you are able to do good implant dentistry at the same time. So I think that was what intrigued me the most. And a lot of people are very focused on either I'm a soft tissue person, or I'm an implant person, or I'm a pure perio person. I see periodontics as an all-encompassing, our main goal is to regenerate, right? And if our main goal is to regenerate, whether be it implants, be it tooth, you still need to have the same philosophy and same understanding as well, not just soft tissue only. Yeah, I think that's what I am passionate about, or what I feel. We still have a lot of work that can be done, especially with biophysiologies and stem cells and everything else that is possible for regeneration that we do not know at this point of time. Yeah.
Amazing.
Yeah, that's a very, maybe a topic for another, let's say, ProTalk, because I'm also very fascinated by tissue engineering and cell biology, engineering actually, tooth pods.
Yes.
There's some research going on, so very fascinating.
It's one of the hardest and the toughest, because in order to get predictability and periodontal regeneration, that's also one of the hardest topic as well. And not many people, we used to joke, during residency time, in Italy, the publications that come out, and this might not be such a good thing, but I will say it. In Italy, when all the publication comes out, they are able to regenerate everything. Yeah, they can gain 4 or 5 millimeters. And when it comes to the United States, and where they're regenerating, we only get 1 or 2 millimeters, And
that's different population.
It might be the population, but what we call it is the Pope's water, the holy water.
Holy water. Okay, so they have the holy water there. Okay,
we need the holy water.
We're still in the search of the holy water, I guess.
Yes.
When we look a bit at your, let's say, career, I think having a good progression is not linear.
Yeah.
And sometimes you have to take very difficult decisions for yourself. What has been one of your most decisive moments in your career? And, what did you have to decide at that point in time?
I think there was a lot of issues before I went to the States. And that was one of the most defining moments in my career. There were two things. As a woman at that time, and having a boyfriend at that time that wanted to settle down, it was between either you get married and have a normal, usual life, or you move on to go study and do postgraduate. And I think that decision came when you have a bigger purpose of what you want to do and the passion in dentistry, because I saw what was possible with regeneration on implants. And that was when Professor Joseph Khan came and showed me this slide. And I have to thank him for it, because he's one of my first mentors that really taught me very much on implant dentistry, where he showed me this traditional carousel slide and said, pick which one is the implant. And I could not.
Oh, really?
I could not.
Yeah.
And that was the defining moment that I realized, my God, implants are going to change the way we practice dentistry, and it will be here to stay. Despite what I saw, I nearly gave up in implant dentistry. A lot of people think that, like you say, it's a linear progression. It was not a linear progression. I did masters in applied commerce, wanting to quit dentistry in actual fact, because
really?
I was
You were considering quitting dentistry. Oh,
yes, because the responsibility of treating a patient or being a medical profession is you hold a lot of responsibility, especially if you're placing implants, because you're putting a foreign body into a patient. You have to
you should stay there for 20 or more years, and you can't escape. So
yes, you can't escape. And so whatever you do, it has a permanent effect on the patient. And you need to be responsible for what you do. And that's what I saw in Singapore. And I saw all the complications and all the stuff that could happen. And I'm thinking to myself, this is too much responsibility for me.
Do I want this? Do I want to be part of this? Yeah.
That's right. I'm like, I didn't take up dentistry thinking I was going to hold so much of responsibility. And I said, maybe it's time for me to look for another job. Yeah, like look for another industry. That's how I did a master's in applied commerce. But luck has it such that when he showed me the slide, when he was in Melbourne, I realized it was still the way to go. And I still saw a lot of patients with periodontal disease that are not treated properly, are not given the options of having implants. That's really unfair to them. And that's when we have to move on. And that was one of the most defining moments in my career, where it changed my life, where I ended up in the States. Yeah.
So you had to take a decision between, let's say, the normal progression of life and also a more special way of continuing, which actually for you meant that you went to Loma Linda University.
Yes, that's right. Yeah.
That has certainly been a very difficult decision, I can imagine.
Not that my parents were very happy with me at that time. You could imagine.
I can imagine, yeah.
You could imagine. But I always tell the younger ones, there is always a reason why certain doors are open to you. And if the doors are open to you, please take the opportunity and don't regret. And if you don't take the opportunity, do not regret as well. It usually means there is something else for you to do. And life is such, it's like what we were just discussing. It's like what Albert Einstein says, you just have to keep paddling and you just keep moving. That's the only balance you can find. Yeah.
You mentioned Joseph Kahn. Was he one of your mentors then, that you would really consider also being very influential on your progression?
That's right. That's right. Very much so, because he's a prosthodontist, surgically very well trained. And I was in the perio department, and obviously perio, soft tissue and implants in those days, completely different path of treatment, methodology, as well as thinking process. So there was a lot of that drove me into immediacy. Yeah. And what I saw in Loma Linda was pushing the envelope, knowing where the limits are, finding new ways to solve problems. And that's what we need to be inspired to. I think a lot of people nowadays tend to get into a zone where you are in a comfort zone. You want to practice all safely, going it scientifically proven, but sometimes science takes 20 years to prove certain things. So we do need to take the leap of faith. But the bottom line that I tell the younger ones is that do no harm. as much as possible. Please do no harm. Don't think you are a superhuman being or a superhero that you can do everything. That's not possible.
And don't experiment on the patients.
Yes,
I guess,
that's right. Yeah.
I mean, particularly in the younger, let's say the early days of a career, we often depend on good mentors.
Yes.
What would you consider the best advice that you ever got, and by whom?
Okay. This was given by Professor Max Krieger and Professor Jon Ikebel, who has now passed, both. When I got into the perio department, the first session that we got, it's like onboarding. There was both of them sitting down there, and Professor Max Krieger say, if you think you're coming in here the next 3 years to find all the answers you want about periodontology, you are so wrong. You are not going to find all the answers at the end of 3 years, which means you're going to be serving here for the next 3 years, and you're still not going to find any of the answers. And I'm thinking to myself, why am I here? Right? And the next sentence he said was, this next 3 years is where it's going to open up your mind to ensure that you ask the right questions and push yourself and find new ways to do things and find new methods to improve this world of dentistry. And also, secondly, he said one more thing. We train you for the next 3 years. It's not for your selfish being to be able to do well in your work, but for you to also be able to share it with your colleagues. And I think that has set in me deeply till this day, which is why we do so much in RTS and Ancora Imparo. Yeah, because it is a responsibility that he has put on our shoulders, that we are training you the next 3 years. And the reason why we train you is because we don't know all the answers. And if we don't know all the answers, we depend on you to make sure that you ask the right questions at the right time and do as much as you can and pass it on. And I think that is one of the best legacy that they have ever left for me. And I hope to be able to pass it on too. Yeah.
That's a beautiful story, and it also explains your passion for education, certainly partially. Yes. And obviously it has been set very early on to a very inspirational starting point of these 3 years of education.
Yeah. Yeah. I think I'm super blessed to have met people like Max Krieger, Jon Ikebel, as well as Professor Joseph Kahn, who have all inspired me to move towards excellence, and that's one of the hardest things. And I think there's a big difference between excellence and perfection, because what we see nowadays is often about perfection on the lecture rooms, and people show the best of the very best in all scenarios. And in life, it's not like that. It's in not practice. Like this. In real world, it's not like that.
And I think, how can other people learn if you're not open to also show your failures and show how you treated failures personally, so that you can actually talk about it? I greatly admire those people that actually can talk about their shortcomings that I think every learning individual has sometimes, because it's I believe it's the greatest opportunity to also learn.
Yeah. This is one of the examples of Joseph Kahn, right? He published exactly immediate aesthetics in Century Incisor.
Yes.
It was going well.
Yep.
Year 1, he was going well. Year 2, he was going well until he got the call from the patient. And then he was humble enough to rewrite an article to say, everything I said in the past was wrong. Don't believe in that one. Now we have ways to make it better. He was so humble and so honest.
Yes. I think that's what we are trained to do in that environment. And if we are all trained in our medical field to do that, I think progression of medicine will be so much faster, even in dentistry as well. Very often we hide what we don't want others to know. In actual fact, there are big learning lessons that even if you can't solve, somebody else will be able to take that lesson and find new solutions for it. And that's what I think they were imparting on me as well. Yeah. And anterior implant aesthetics, to be fair, I look at my cases now, 15 years ago, 10 years ago, 20 years ago to now, very different materials, products, methods, things that are available. You can't blame the people who have placed implants 30 years ago that they don't look aesthetically correct, because in those days, that was the norm.
How it was done,
Yes.
how do you see the onset actually of social media? Because you're also very digital, and maybe we talk about the digital lab aspect and digital dentistry later. A lot of the things that before, took years to actually come to the practice, nowadays it takes much shorter because digital basically accelerated everything. Now, there is also less peer-reviewed research because a lot of people, they don't even, read articles anymore. How do you see the onset of social media and this faster progression in digital in terms of when it comes to, does it do good to the patient, or is it even more so showing the nice cases and less the ones that did not turn out that well?
So what happens with social media? We're all human beings. We all want to look good. So it's not going to have ugly things on the social media. And that gives a lot of misleading information to patients. So we have patients that come asking for laser therapy that's going to treat everything, which is, laser doesn't treat everything.
I want to look like this picture.
So that's the unfortunate thing about social media. However, this is meant to happen in the sense of progression. Without this, human being cannot progress because patients were never demanding before because they knew so little. And now with social media, the good news is they became more demanding, which means they will ask the right questions, and the smarter ones are going to get to the right people and get the right treatment. You're going to see a glut of all of that coming out, be it good or bad, before the true good. And I always believe in that. In all competition where you see implant companies too, 20 years ago, there were hundreds of companies that came out and everyone was just as good or even better
than the rest.
That's right. But everyone. And it was a big confusion for dentists. But eventually things will fall apart and it will show which are the good ones and which are the bad ones, and which are the ones that are going to stay and which are the ones that are going to stay with you and with the patients. And I think a responsible, ethical company would grow with the fact that you take responsibility for what happens, and we are continuing to research and go forward and move on to better and better products. Same goes with the dentist career path. I may have done something 20 years ago I would not do now because that's what I know. But the patients need to understand that technology at that point and knowledge and scientific articles didn't come out at that point to show this direction. And thus, we now know this is a different way to practice. You can't fault what has happened because it's very simple analogy that I tell patients. If you're buying a car, you don't expect the car to last your whole lifespan. In implant dentistry, you expect the implants to last your whole lifespan, be it 60 years. And that's kind of hard to
accomplish.
Yeah. And yes, we do have cars that last for 60 years, but they will not look the same. They do not look the same for sure.
Or function the same.
Or function the same. And you have to accept that it doesn't look the same and it's not going to be the same. It's as long as what is most important to you. If aesthetics is most important to you, then we've got to deal with it differently. If function is most important to you and it doesn't affect your life, let's make do with what we have now because it has served you 60 years, let's say, And yeah, I think we have to be practical. And if you are able to communicate to patients and the public in the correct way, and I think it takes companies like Straumann to be able to create public awareness of what's good and what's not so good, or we don't need to say that, but we just need to say that, hey, there are certain criteria and you should look for certain things when you're getting an implant. I think those are what the industry would benefit from, not just from a dentist, also from a product and company point of view. So I think that will come. And I'm very sure why you're doing this is also part of that.
We're working on it, so we're trying to do our best. So while you can learn in terms of treatment choices for the next patient to come, some of the life choices you can make them once. And as you mentioned before, you are a family, so this family is important to you. And what would very much interest me and also the listeners is, how do you balance actually professional and private? And maybe to extend this, what would you recommend to a younger self with what you know today?
So I used to be very harsh on myself. And because of my training previously, that we have to be always on our toes and do the best that we can for our patients and always be there and do excellent work. It came to a point that I realized, and one of a life mentor, who talked to me and said, you have to realize, Jeanette, like you say in the bicycle, life is a journey. At certain point of time, you have to slow down, and the slowing down is because of other priorities coming into your life. So I tell the younger ones that you can't do all at one go. You want to set up a family, you want to have the best career, you want to specialize, you want to do everything in one go. That's not possible. I mean, there's only 24 hours in a day, you know. So you need to make certain decisions at certain point of life and realize that, hey, maybe at this period, this is what I need to do. The next period is what I need to do. But you're still working towards the goal of where you want to be. And I think where you want to be is what you set yourself to. Some people are happy just being a GP, and they can be a super GP too, and they do far better and they have a better life. There's nothing right or wrong about that. So it is that period of time where I was breastfeeding my kids for 2 years, every one of them, as much as possible. I slowed down. That first 2 years of my kids' life, I slowed down. I don't lecture, I do less work, and I see less patients. And of course, I had patients that were upset with me and left us. But, you know, they came back. Some of them came back, but that's part of life. And I don't regret it now. I was very harsh on myself at that time. I would have told myself, hey, this is part of the journey. There are going to be more and more better stuff that comes down the line, and you need to find that balance. And I think that's what I would have told my younger self. And I told a lot of the younger ones that always look at me and ask me, how do you do this? You only have 24 hours. Why do you do so much? You know, like, right? I say there is certain point of time that you do everything. And the life mentor told me one thing. When you're in the clinic, make sure the support system at home is all there and that everything is safe and everything is good. That when you're in the clinic, all your attention is to work and to the patient and to what you need to do best. The minute you settle everything, you walk off, go back into your house. The minute you step into your house, everything back to the kids, you know, at that period of time. Once the kids are settled, they have gone to sleep. Okay, now you can do your own stuff. You know, like, yeah, sorry.
So the second half of the day starts.
That's right. That's when you start doing stuff. Yeah.
That's very inspirational, and I hope that you know, this gives also energy to a lot of very gifted young dentists in the community, because obviously it can be done.
Yes.
And you know, don't be too harsh on yourself. It's possible to actually be successful, obviously, on professional and private. And
this applies to males too, because nowadays it's so important for the father to spend as much time with the kids. And if they need to rush back and go back to the kids, it's also hard for them to dedicate the rest of their time to try and push and, you know, do as much. Yeah, it is one of those things in life. We all have to find a balance. Yeah.
Jeanette, speaking of work-life balance and quest for excellence, right? In this journey, I see here you've been in Melbourne, Singapore, California. You're doing some punctual activities in Edinburgh and Kuala Lumpur. Huh? They say home is where our heart is. Where is home for you? And where can we expect you might end up next?
That was a very good question. Thank you, Christian. I have been so blessed to be living in all these countries in different parts of the world. Now, at the moment, home is Malaysia, Kuala Lumpur, because that's where your family is. And I always tell people that where your family is where home is. For what it is to come in the future is where it really depends. Nowadays, I think that if the kids, wherever they're going to go, it is still home to us, because we are now global citizens, and every country has its pros and its cons of where you live, and what career path leads you to gives you the opportunity to do the best work. Why not? Yeah.
So you would be open to different locations. Let's see. Okay, so this is
roll the drums.
Yeah, roll the drums.
No, there is no revelation yet.
Okay, next episode.
Yeah. Right? Next episode.
Jeanette, I'd like to shift gears a little bit and talk about immediate implants and also public advocacy. I know you're very strong about this, and you've done quite some significant work with immediate implant placement and also immediate temporization in aesthetic area. Can you share some of your decision-making process in this particular indication?
Okay. It is important to realize that science has moved so much now, that we have so many consensus statements and beautiful people and groups that have done articles that have published on immediacy that have set out many keys and criteria to do excellent immediacy work. And I think for anterior implant aesthetics, there is Moulton, there's Levine, there's Kahn. In total, when I read the articles, there are like 26 key factors to ensure that you get immediacy right for anterior aesthetics. I don't know whether you realize that. I've calculated all of them.
Wow, that's a lot.
I imagine airplanes.
Maybe Christian knows, but
It is. When I look at the list, I remember in those days that we didn't have this list, but the instinct was regeneration. Do no harm, bring it back to nature, and that's what you want to do. So if you understand science, what you do and what happens is going to maintain, grow, or regenerate and allow a better aesthetics or better outcome, that's going to be the way. So the decision process remains mainly on two main factors: the site itself and the patient. And the site includes the neighboring teeth. So in aesthetic zone, you have to realize you are affecting a patient's smile. And be it a low smile line, your white aesthetic still has to be there. And be it a high smile line, then you really have to make sure the 26 key factors are there, to make sure you get it right. All right. So if the low smile line, and if patients are willing to accept certain imperfection, I would call it imperfection, but still excellent work, and that it's going to stay and survive and maintain at that point for the next 15, 20 years, because I think that's about the bare minimum we are looking at nowadays, not the 3 years, 5 years kind of thing. If we are able to do that, then I think that's most important to ensure you can do the immediate implant, gain primary stability before you decide on provisionalization. So those are the two main factors. All the other key factors, more than happy to give a whole full day lecture on it.
Yeah. And how do you think the industry has helped you in that way? For example, we were just discussing about Joe Kahn, and in the beginning of immediate implant placement in aesthetic zone, implant was perceived to be a cork, right?
Yes.
You have to plug that socket. Now we talk less is more. So we're also developing better alloys, different diameters to enable less metal, more biology. Right? How do you see the whole industry evolving to enabling this path?
Well, the industry, Straumann is one of those that really made a big shift in order to make sure that we moved on with time with what immediacy was doing. All companies have developed, a lot of companies have always tried to look for ways to make immediacy easier. Firstly, it's not an easy technique or process, and you do need some experience to be able to get it right. And the products nowadays allows better stability, high torque values to ensure you can actually gain good stability quite easily. Then the provisionalization as well as digitization allows you to do pre-planning, do pre-preparation of temporaries. All of that has made life so much easier to our industry, our profession. I used to have to sit 3 hours preparing a temporary. All right, yeah. The surgery might take 15 minutes,
But then
then you're down there, trying to get that perfect hem, to get the right emergence profile and the submergence, whatever lines and everything else, and then get the right occlusion and get the right fit. That takes so much time. Nowadays, it's so different for us with digital. And that's why we moved on to digital very, very early on. It was because if I could cut down this amount of time, I would, because we would pre-plan it, get everything ready. And having the 3D printer, the milling, everything all done pre-hand. Yeah.
And maybe the patient needs to come for one visit less.
Yes.
And I think then it has also a big impact on
That's right.
the patient's happiness, I guess.
Yes. Patient happiness. That patient happiness score, we don't have enough publication on that.
What makes patients happy?
Yes. And I often lecture in immediacy that it is still, in the very end, the decision-making process is the patient to get a with you understanding what's possible, what's not possible in this scenario, is it a good thing? And what your expectations are. And I think patient happiness, would they want to gain 0.5 millimeter more soft tissue and ensure zero recession and end up with 3 surgeries, or would they want 1 surgery and accept that there may be a 0.5 millimeter recession or 1 millimeter recession in time to come? And I think that's something that it's been drummed up a lot, and we all as profession in dentist, well, we want it perfect, but what is excellent?
What's good for the patient is maybe a different story, and it's
right.
very, very individual. I mean, depending on in what situation, at what age you are, and
right.
you know how aesthetic the case is.
Yes.
It's such a big difference, and
Yes.
I think you can do magic,
Yes.
but the patient doesn't always want the magic, so maybe
that's true. But that does not mean you should do sloppy work
no,
well.
That's not what I mean.
Yeah, that's always hard. It's a very different line. I get very scared sometimes, because when we say this, then somebody might just turn it around and say, "Oh, now I can do everything." No. Oh my God. Yeah.
And immediate treatment solutions have been very well described and fundamental.
Yes.
Yet there could be some pitfalls that we should watch out for. What do you consider the most common pitfalls clinicians fall into?
The 2 extremes.
Ooh.
Yeah. There are the 2 extremes. The 2 extremes of immediacy is when you want perfection and you're trying to get the angulation of the implant to be in the perfect position, not realizing that you're probably not going to end up with primary stability, or you're going to do something quite crazy to destroy the bone and everything else, okay? So that's the perfection kind of extreme. That's the common pitfall, which I see a lot of dentists tend to do, because they're trained to, like, I've got to put it in this angle, in the implant position is got to come out at the cingulum, and, not all the time immediacy you're going to have implants coming out at the cingulum, because you don't have bone that's this wide, right? So I think that's one. The other is the finer temporalization, or when they try to gain primary stability too much, where they start angulating implants into way off positions, and you end up causing recession and, awful things that we should not be doing. Then when they temporize, because that's the part, if they don't spend enough time in ensuring that there's a good fit, that you are out of eccentric contact, no matter how beautiful your implant is or what you've done, it's still going to fail. Yeah. That's because of occlusion.
Check. Jeanette, I'd like to shift gears a little bit towards education and treatment and education philosophy. You're an ITI fellow.
Yep.
Section chair.
Very blessed.
And very engaged with speaking globally and educational activities. How has the ITI and this international network help you shape your clinical decisions, but also your educational philosophy?
Yeah. I think ITI is one of the strongest, it's probably the strongest at this moment of time when it comes to implant education. And this community is definitely necessary for us to progress in implantology. So when I get to meet people around the world and see what everyone is doing in education, that gives you inspiration and energy to continue what we do in our small little section or small little corner in Malaysia. Education is going to be forever there, because we don't graduate from dental school knowing everything. That's a fact of life. That 5 years or 6 years or 8 years that you do in dental school will not give you
everything. That's
everything.
Clear, yeah.
Especially implants.
Yes, especially in implants, because it's not even in the undergrad curriculum in a lot of schools. So continuing education is one main part that will ensure your dentist, even in a practice like us, where it's multidisciplinary, we have GPs, we have other disciplines, they still need to understand implants, even if they don't do it. And I always tell my younger ones, they you really need to understand. I don't care whether you like it or you don't like it, but you need to understand. Because if you don't understand, you can't do proper treatment planning. You don't give patients the right options as well for what is possible for them. And this is more so now seeing that I thought it was just Asia that we don't get as much education, which is why we started Ancora in those years. But now meeting everyone around the world, I realized that it's a common mission we all have to do, and seeing everyone doing that part as well, especially ITI and Straumann doing so much, is just inspirational, and it just allows me to continue doing this, as well. Yeah.
That's a perfect segue to talk a little bit about Ancora Imparo. Can you tell our listeners a bit more, what was the guiding principles? Why did you build it, and what do you try to achieve with it?
Well, Ancora Imparo means I'm still learning. And why I built it together with the artist group, with my previous, my current partners and all, it was because we knew that in order to bring the younger ones up to a certain level and ourselves to continue to learn, we need to bring the best of the very best from around the world to Asia and make it available for as many people as possible. And that was the philosophy of what Ancora Imparo was. We will never stop learning. Technology is moving so fast. And we knew at that time in 2015, we need to invest in digital. We need to move on with the digital lab. We need to move on and to understand what's going to go on. Dentistry is making a fundamental and a very critical transitional change that we probably would not have, in centuries.
Foreseen.
Yes, because of digital.
Exactly.
Yeah. So this is a critical moment for the industry, and we need to either do the right thing or we're all going to be left behind. And even if you decide not to change and not catch up with digital, you're going to soon realize that you can't practice properly anymore. And then that's the reason why we started Ancora. And there's no point of only educating yourself. You need to educate your peers, people around you. They're referring network, and the entire country would benefit if everybody moves up. Yeah.
So you start with the mind of actually educating your own clinicians first, and also with a very digital mindset from the get-go. So in 15, you start your education journey.
Yes.
Now, at which point in time is it today? So, can you tell a bit more about the facilities and maybe the platforms that you're offering?
Yeah. So I think we've gone on to build to full-fledged operating theatre, because it's really important, especially for surgery, for people to realize that you need a good environment for infection control, and you need to know how to do surgeries under sedation in a safe environment. And of course, that was setting the standards, and that would be the best way to be able to train younger ones, that they understand surgery is not doing it slip-slop. And you need to know what you can and what you can't, and bring back whatever you can into your practice. And I think that was it. We have a training hall as well, a huge training hall for lecture. And we also have Envision Training Center together with Dr. Nazari, that we have microscopes and we have phantom heads to ensure we train under the microscope and then the phantom heads to practice as much of what we can do. Yeah, so we have built on in terms of facilities. But the main philosophy is having the facility and environment to be able to do practical and real work. And I think that's important. Hands-on are extremely important. And then watching live surgeries are extremely important. Being guided to see how things move is also extremely important.
So you also offer mentoring for people coming there doing a residency?
Yes, we do as well for implant dentistry, and that's together with the ITI curriculum.
Very good.
Yeah.
So for everyone who is interested, please make sure you check out Jeanette's education portal, and also the possibility to maybe take courses with you. So
yeah, and we organize every 2 years a 3 Masters program, and this is coming up next year in February in Malaysia. I hope the both of you that we can invite you both into Malaysia.
That would be great.
That would be great.
So let's talk a little bit about the future of dentistry, because we now heard that you have a digital lab. You very early on actually have foreseen how important it is what this digital transition is going to bring for dentistry. And it has even accelerated with AI. So there is so many new tools that actually we need to understand what it can do, where the limits are. What's your vision of dentistry in 10 years from now? How will we do, let's say, implantology in a decade?
I think that's the magic ball question.
Exactly.
Now we roll.
Well, now we're rolling. Well, when I graduated, we never thought digital was going to go this crazy and this fast.
No one thought about this. It's like no one could foresee this.
How would you even imagine the robots are going to do surgery for you, right? We're seeing that now. And it's going to move so fast with robotic surgery, with AI, that it will happen probably within the next 10 years. Not even, I thought I was just going to retire and not be able to, don't need to deal with computers and AI and robots. But no, it's coming. It's coming faster than we thought. And I think all of us need to get into it in order to be able to practice safely. If not, what happens with dentistry when the robots take over? It still needs a human being. And you need to understand and have enough experience to understand how to make sure the robots do the right thing. So it still comes down to diagnosis, treatment planning, all of that basic stuff that we need to have. So I see dentistry or implantology changing towards being more automated, but we are still going to need people to be able to, or companies that are going to build us tools to ensure that the right things are being executed. Yeah, that's the hardest part.
Wow. Yeah. So robotics you see as a reality in 10 years from now in dentistry?
I see the big groups. We are driven commercially, unfortunately, in this world. So it's a marketing tool as well. Can you imagine patients say, "Ooh, if the robots are going to be more accurate than
the humans,
why not?
This.
Yeah, why not? Yeah, and if it's going to be faster and safer, why not? Yeah, we are going to end up with that. They might not be able to suture at this point of time or raise a flap, but that's okay. That's the human part. But placing the implants, let's have that. Yeah, going on. And I think it will come on. The cost is probably going to be very high at the beginning, but I think the bigger groups of dental groups, insurance companies might tend to be the ones that go into it first. And human beings are so smart, and we develop things. The first few versions might be super, super expensive, but it will get cheaper and cheaper as it goes. Yeah,
that's what we see already. So it has made tremendous, let's say, progress. And I'm very fascinated by how quickly also Asia moves into this field. And
especially China.
China, yes. There's
a
lot of companies that are moving in that direction. And probably it's also a bit natural in medicine. So if you look at other areas like neurosurgery or ophthalmology,
that's right.
It's already there. Yeah. So it's more about, what problems can we solve with robotics, and how does this job sharing between a certain machine that helps you to do certain steps.
Yes.
And the dentist work. So I see it more as a augmentation of skills and not a substitution of skills. And
that's correct. Yeah, that's so important. That's why we call it intelligent medicine, all right? Because the tools are not there to help you not think, but it's there for you to ensure that you do and make the right decision for the robots to perform it correctly. Yeah. So it is still down to human beings and the experience. Yeah.
Wow, that's a very good discussion to have. But it already brings us a little bit to the end of our Pro Talk. So we make it a habit that also our guests can ask questions to us, and I think you have a question also for Christian, right?
Yes.
Yeah.
No, I think Christian, what made you decide to leave clinical dentistry and work for a company like Straumann? Yeah.
Well, that is $1 million question. No, I'm kidding. I graduated in 2005. And in 2005, I was already in a dental implant residency, right? So I dedicated my entire professional life with dental implants.
Yes.
And already further ahead, involved with good mentors that brought me to their institutions and became faculty in 2 schools. One of the schools was also ILAPEL, as we already know. And as you may know, in Brazil, we are groomed already immediate.
Yes.
Immediate solutions are already part of the Brazilian dental implant education. Over time, when I decided to enroll the master's in perio, and later the PhD as well, there was tons, fast forward, right? Master and PhD is not a week long, we know very well. But over this period of time, there was a whole bunch of animal studies, fatigue tests, and tons of the back end of what I was doing to patients that it was equally fascinating to me, not just to see the outcome, but how those things were being affected and bringing to life what that could potentially be. And that sparked in me this huge interest to, what if I join the industry and have for once the opportunity to have a fingerprint also closing the loop.
That's the altruistic part of him.
Yes.
And help close the loop. So maybe my naive philosophy or mindset was like, maybe I can help the industry to help my peers, to help their patients. And it feels like this healthy,
Dr. Christian Jerry implant.
healthy loop. And then I could not find a better place than Straumann, because we have the most powerful brains in this building, from engineers, from product management, from you name it. And it paid off, because exactly as I expected, I was able to participate in core teams that could bring products to life, also animal studies, test prototypes, and have a tactile feeling to give a little bit of a North Star to the engineers, for example. This is at least the right direction. Of course, we have to validate outside, because one opinion doesn't matter. But at least, it matters, but don't get me wrong. One opinion is one opinion. But just to give the North Stars to engineers so they can hit the ground running and continue what they're doing, and then later see this blooming out and see users like. That's how we met, for example, with the BLX, correct?
That's right. We met because of BLX.
Yes, exactly. For the casebook, right?
There's nothing more rewarding. And that's exactly why I don't regret it. Of course, we have some clinical activities still, some of the clinical early validations, but it's not my daily core work. But I'm still very happy with what we do today.
No, but it's just amazing. I don't think enough people realize what you guys do and how important it is for people like you, Dr. Jerry, and as well as yourself, Dr. George, to dedicate this amount of time to provide us with products that can withstand, be it 50, 60 years if we have to. And I think that's so important. I've seen it in my first year, where I saw, one of the story was, if you don't mind me sharing.
Sure, go ahead.
One of the story was how I wanted to quit dentistry was I was struggling with this patient for 6 hours. And that was the first year out of dental school. And of course, I had implantology training by my ex-boss. It usually happens on a Saturday afternoon. This German guy comes in with a loose crown in his mouth that he had the implant done in Taiwan, and he goes, I need this out. It's irritating me. It's hurting me, and I can't pull it out. I can't do anything with it. And there we go. In those days, it's, let's just drill and get the access hole and try and talk it out or turn it off and turn it out.
And it turned out not to be so easy. So.
Yes. For the next 6 hours, we were struggling together with the best technician in Singapore at that time, together with me, and we could not find the screwdrivers. Guess what happened when we called? Yes, we could not get the thing off. When I called, when he finally got on the line with the dentist that placed the implants, guess what the dentist said? Oh, the implant company has collapsed.
Yes, it's not. There is no screwdriver anymore. There is no. Yeah, exactly.
Yes, and I think Straumann has stood true to what it wanted to do, and it is really important to ensure the longevity and how the company grows, to ensure you're putting products into patients' life, and they may be there for a long, long time. And that's where I tell the younger ones, it's important to stick to a good company and place good implants, as well.
And there need to be replacement parts also for other, let's say, implants. We feel quite responsible also for, what's in patients. There is such a big portion of medical devices that are from companies that maybe 10 years, 20 years ago, they were thriving, but they don't exist anymore. And, just the identification of what product is not easy. Yes. And then let alone finding replacement parts, which is very difficult.
Yeah, that's right. Especially when it's fully osseointegrated, no bone loss. And then you can find a part. And that's so sad.
Take it out for this? That's very bad.
Yeah, that's so sad.
With all digital technology, right? We should be able to do better.
George, we're coming to a wrap. And we covered quite some really good insights with Jeanette. And I was curious, between everything that we talked, there's purpose, there's community, but I would like to know from you what stood out on today's conversation.
So I really liked the conversation. Jeanette, thanks a lot.
Thank you.
It was very inspiring, and I think two things stood out for me particularly. So first of all, your humbleness to talk about your own career path, maybe your failures, to let others also learn from this. I admire this because it's so important. We're not perfect, and we're all work in progress. Yes. And being able to talk about this, to let others be part of your learning journey, and then even building your own educational network, and build this basically for the community, that stood out big time.
Thank you.
The second topic that really resonated with me is how you reflected on these different phases of life, so that it's not only work. It's also, I think, if you're in a good social environment and you have family, I believe you can achieve even greater things. And in your case, you managed this very proactively. You had to take very difficult decisions, and also this that really stood out for me. So
thank you.
Thanks a lot for sharing it.
No, thank you. Thank you for inviting me.
No, you're welcome. Yes. So, as you said, Chris, so this brings us to the end of this episode of ProTalk. I hope you enjoyed it. So, to our listeners, please also look at our social media channels, Straumann Instagram account. Jeanette, again, a very warm thank you to you for taking the time.
Thank you too.
And we hope that you actually have a lot of interest to stay tuned. And with this, I would also hand over back to you, because you have to make an announcement for the ProTalk channel, Christian.
With pleasure. Well, with the success of Straumann ProTalk, we have decided to bloom it into a new stream that's going to be called Straumann ProTalk Clinical and Science. With the ProTalk Clinical and Science, we're going to bring the top professionals to discuss tips and tricks, do's and don'ts, and pitfalls that we should watch out for in clinical outcomes. And as well, the scientific part, we're going to discuss and bring the authors of the most relevant articles and dissect them, discuss them in a fun way with a clear purpose. You know what that is?
Yes.
How will the findings help your decision-making process the very next Monday morning? Can't wait to share this all with them.
Beautiful.
Excellent. That sounds great.
Congratulations.
Chris. So we're looking forward. And please, to everyone, stay tuned. So there will be even more content, hopefully very interesting content coming your way. And with this, thanks a lot for tuning in, and see you in the next episode.